Hello, ladies and gentlemen. My name is Ryan Griffo, and this is Health and Wellness. Today, I'm honored to be joined by Bob Sariani and Trish Mayrow of Salish University, and today we'll be speaking about speech-language pathology. Bob, my first question is to you. Can you please explain the medical profession of speech-language pathology, and what does a speech-language pathologist do?
Thank you, Ryan. A speech-language pathologist is a professional who works in communication sciences and disorders. We assess, treat, and actually work in prevention of various communication disorders in speech, in language, voice, fluency, which is stuttering, cognition, and swallowing. We work with pediatric and adults, and we work across a variety of settings in the education field as well as the healthcare.
Very nice. And Trish, now, for you, what is the typical education of an SLP?
Well, the entry-level degree for a speech-language pathologist is a master's degree. And during your master's training, it's both clinical and academic. So there's experiences working with clients and patients as well as learning the academic side of the profession. We pass a national exam to get certified. We work for 9 months under a mentorship called a clinical fellowship year. And after that, we can call ourselves a speech-language pathologist.
Oh, very nice. Bob, going back to you, how does the SLP work with the physician?
Sure. In healthcare settings, SLPs are required to work under a physician. Basically, a physician orders an assessment which is completed by the speech pathologist, and then a plan of care is created. The physician then reviews that plan of care and signs off, basically, saying that he or she agrees with the plan that we've decided to do. And then we work with the physician throughout that plan of care, as well as other professionals in the healthcare setting, physical therapists, occupational therapists, nurses, nutritionists. There's a variety.
Definitely. Trish, now, can you explain some of the most common speech and language disorders that you treat and the treatment approaches that are used in treating patients with those diseases today?
Sure. Well, my emphasis is in the pediatric realm, so things that I would be treating are speech articulation disorders, a delay in language development, both expressive, that is speaking and understanding language, children who have stuttering, we would work with, voice disorders, so vocal hoarseness, as well as we have feeding and swallowing issues with some children that we would work with. So there's a variety of diagnoses we would work with, and depending on the setting, we would have different treatment. In most settings, you could go into the home with the very young children to teach families how to develop the speech and language skills of their children who are delayed. You can go into preschools and schools and work with the education team, both teachers, teachers' assistants, reading specialists, other professionals in the education realm, to work with school students. And you could work in a clinic at a private practice as well to work with people who decide that they want services privately. Then you would do your assessment and your treatment in the clinic office.
Definitely. Now, Trish, back to you. What is the present scope of SLP, and do you foresee that scope expanding in the next 5 years?
Well, we have a large scope of practice, so we work with speech, as I said, language disorders, swallowing disorders, fluency disorders, resonance, feeding and swallowing, as I said. So we kind of run the gamut of communication disorders. And as we go ahead in the future, I see that more and more children are being diagnosed earlier and earlier with speech and language difficulties. So we're looking at different ways of preventing these speech and language problems as well as treating them. So I think that the edge of our profession now is in the prevention of speech and language disorders.
Definitely. Now, Bob, as people are living longer and there's a greater focus on advancing geriatric medicine, do you see the role of the speech and language pathologist changing in any relevant way towards the geriatric focus?
Sure. You're right. And as Tricia mentioned earlier, prevention seems to be a big focus in our pediatric as well as at the other end of life in the geriatric population. Folks are seeking out services of speech-language pathologists to prevent changes in their cognition, They see themselves having changes in their memory, in their focus, and they can actually work with a speech pathologist to be trained on how to do things a little bit differently so that they're more successful, that they can stay in their homes longer, that they can stay at work longer, that they don't have to retire, that they can stay driving. And they might seek an SLP services so that, again, they continue to remain a functional part of the society.
Definitely. Trish, my next question to you would be, what are some signs that a child needs intervention from a speech language pathologist?
Well, the signs, since we run through all of childhood, early childhood would be if they weren't meeting the developmental milestones. And pediatricians often will ask parents, is the child combining words? Does the child understand directions? Things like that. That's a red flag. If those answers are no, then a physician would refer to a speech-language pathologist for an assessment. In the school realm, literacy is an issue. So children who have speech and language disorders may also have reading disabilities. So a speech-language pathologist would be part of a team to assess and treat children with literacy disorders. And then as you go further along, we also have voice, stuttering. So if there's a problem that develops with any of those areas, a referral to a speech-language pathologist would be in order.
Absolutely. And Bob, if you can answer that same question, but about the adult need for intervention.
Absolutely. So adults that have any type of medical condition like stroke, Parkinson's disease, dementia, they would seek the services of a speech pathologist to work in basically the same realms: speech, language, cognition. Certainly, any difficulty with eating or swallowing, that falls within the realm of speech pathologists. So if they feel like they're choking or coughing when they eat or drink something, they may want to seek out the advice of their physician and a speech pathologist to determine what the causes are. Any changes in voice or speech are not normal to aging, so they should again seek physician and speech pathology assistance in that problem. And any changes in their communication, whether they're having trouble thinking of words that they want to say or remembering appointments, an SLP might be able to help in that instance.
Absolutely. Well, Bob, Trish, thank you so much for sharing your knowledge and experience with us here today. And it was truly an honor being here. I really do appreciate your help.
Thank you.
And for Health and Wellness, my name is Ryan Griffo. Thank you for watching.